Welcome back. Thanks for staying with us. October is Breast Cancer Awareness Month, a global health campaign in South Africa involving public and private healthcare sectors. The campaign aims to raise awareness about the disease and encourage screening and prevention. Workplace support is crucial after a breast cancer diagnosis, as it can help women regain momentum, remain productive and aid their recovery. We talked to Barnard, MBA graduate in healthcare leadership at Stellenbosch Business School. A very good evening to you, Mia. Thank you so much for your time. Let's perhaps start off with the significance of Breast Cancer Awareness Month, what it seeks to send out in terms of messaging to the general public.
Good evening, and thank you very much for having me. Breast Cancer Month is very important, as we need to create awareness of breast cancer amongst not only our employees but also our managers and line managers, so that they can understand what it implies and what is the effect of it on our employees that are diagnosed with breast cancer.
I suppose it's also quite a difficult position to seek support in, because I don't know if someone who has been diagnosed would be happy or eager to tell everyone about it. And that position itself perhaps would leave one isolated, not being able to get the sufficient support. What would you advise in that kind of scenario?
I think it's important to understand that being diagnosed with breast cancer is life-changing. It affects a person in every part of their lives. And it is important for us to know that they are navigating not only and have to make immediate decisions about the treatment that they're going to receive, but they've got financial difficulties that they need to navigate, and they have to strike a balance between maintaining their career and taking time off to heal. And employers need to understand that breast cancer affects every part of their lives. And if we don't have awareness like this to make people aware of it, then we don't have a forum where we can discuss this and and put their point of view out to the public.
What kind of support is needed? You speak about support on a different level. You speak about the employer, but what about support from your colleagues at work?
All of that is important. First of all, we must create a supportive environment for these vulnerable employees. They need to feel in control of their future. We must help them keep a fighting spirit rather than feeling helpless and isolated and afraid in this devastating state that they're in. And I think it is important for employers to ask themselves if the organization has a culture that supports individuals in this crisis. And a supportive culture starts with leadership. Leaders are the ones that model empathy and understanding, and that spills over to the rest of the company. And it needs to be fostered by the rest of the company.
Mm-hmm. Screening, a very crucial part as the message is being driven about breast cancer awareness. Of course, talking about preventative measures, but of course it all starts with screening. What are the options and who should be screened?
I think in terms of what employers can do is they can create or establish assistance programs that can include breast cancer screening and provide access for employees to counseling services, which is very important because they're going through emotional turmoil, and anxiety and depression is quite common amongst these women.
What opportunities do you think that employers can look for in creating those environments and in creating that culture that is enabling and supportive for someone who may be diagnosed?
We've just mentioned that you have to create a culture of a supporting culture in your organization that starts with leadership. And then very important will be to educate and train your line managers to deal effectively and efficiently with these individuals. They must be able to recognize signs of distress and know how to handle the situation. And then I will also suggest that companies offer flexible work arrangements. That is very important, and here you have a number of options. You can look at job sharing, working from home, flexible work time, and you must also make the necessary adjustments to the physical work environment, the ergonomics in the workstation, and you must also look at the performance measures of these individuals that most probably need adjustment. And then in order to uphold ethics, it is important that employers understand what are their legal requirements, and they must also adhere to the relevant labour laws. And this means accommodating disabilities, preventing discrimination, and protecting privacy. You need to explain to your employees what these protections mean, and they must understand that. And we must also put the relevant policies in place and make sure that our managers set examples to our employees.
Potential discrimination and threats to job security in an economy such as this would be factors that would be going through the minds of those who are diagnosed, looking to see whether or not, one has no choice but to disclose to the employer, but having that level of understanding and communicating to the employer and ensuring that the employer doesn't think that someone's being diagnosed and they're ready to just simply go back to work as normal is a discussion that needs to be had at a more intricate level. In terms of other support systems, what opportunities can one take in looking at the other support systems within the workplace?
Okay, and just to get back to what you've mentioned, I think there is misperceptions amongst employers as to what are the ability of people to, when they undergo treatment, during and after cancer treatment, what are their ability to work? And that put patients at risk of unfair labour practices like demotions, unfair performance appraisals, and being moved to lower category functions, where some employers just refuse to make reasonable accommodations. And patients soon realise that they are vulnerable, and they realise that they have to make modifications at work, and they look to their employer to help them sustain their work and receive treatment and not lose the careers that they've worked so hard for.
Yeah.
And that is why we need to look at our policies, make sure that they are flexible so that we can accommodate these individuals. It's important for employers to understand that each case is different. Each person has a different treatment plan, so we can't even make a general rule. We have to have flexibility in our policies to accommodate these individuals. There's also other things. We can share knowledge between organizations. We've suggested that they collaborate, organizations in a specific region, and create an online tool, a web-based tool where employees who are affected as well as line managers can access information that they can use to support these individuals, or where employees can access clinical services or cancer support services, or know where's the local breast cancer support groups. So that's also initiatives that employees can do.
Very well. Thank you so much for speaking to us this evening. Mia Barnard, MBA graduate in Healthcare Leadership at Stellenbosch Business School.